Hey, hello everyone, and welcome to yet another Two Talk with your dentist on thedentaire.com. I am Dr. Rekha, and the Two Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. And do log on to our YouTube channel and subscribe to the channel to get your latest updates on your oral and dental health. And today in conversation with me on the Tooth Talk is Dr. Arun Jacob Silas. To give you a brief introduction about Dr. Jacob, Dr. Jacob is a Master's of Dental Surgery in Pediatric and Preventive Dentistry from the Manipal College of Dental Surgery. Passing out in the year 1992, he has 27 years of clinical experience in pediatric dentistry. He is a fellow of the Academy of General Education and has special interests in the management of special needs children. He specializes in the management of chairside conscious sedation and procedures under general anesthesia for child patients. He is the former dean of the Rajiv Gandhi College of Dental Sciences, Bangalore, India. Dr. Jacob is a recipient of the Star Pediodontist Award by the Indian Society of Periodontics and Preventive Dentistry for the year 2007. Dr. Jacob has numerous national and international publications to his credit. Currently, he is the Chief of Dental Services at the American Mission Hospital, Bahrain. Dr. Jacob, welcome, sir, to this.
Thank you so much. Thank you so much for giving me this opportunity.
But I think I should also mention to my viewers that I have been very fortunate to be Dr. Jacob's student during my graduation years. He was the head of the Department of Pediodontics, and of course, his wife was, I think, the most remembered by all of us. But sir, I should really thank you for all the maybe in a way that fear that you had put in us about this subject. I think it really drove us to learn the subject so well, and you taught us also so well the subject, which I can't forget even today.
And now the tables are turned, and you're taking revenge on me, and you're going to conduct Viva with me. Okay. So right now, viewers, it's nail-biting tension for Dr. Jacob for facing this lady here. Okay, and I'm ready for it. Come on, let's go. Sure.
Okay, sir. So I was just looking at some topics that we could discuss about pediatric dentistry, and I thought probably one of the most neglected or ignored areas are some of the oral habits that children develop. Or so why do you think there could be some oral habits? Like either it could be a digit sucking, like a finger sucking habit, or a mouth breathing habit, or sometimes children even push their tongues out, what we call as tongue thrust. So why do you think these habits are there? Is it a normal thing, or is it an anatomical deformity which causes these things in children?
Well, so let's start with, like you said, there are various harmful habits which we call as deleterious oral habits that can affect the child's dentition. So what happens is, once the baby teeth are out, that's when the jaws are developing. So if there's any external effect or pressure on either of the teeth or on the jaws, any part of the jaws, there is going to be a deformity that will develop. So starting with digits, the thumb sucking habit you mentioned, well, it's not necessarily the thumb alone. There are children who suck their fingers also. So normally what happens is, most of the etiology is insecurity or a feeling of comfort for the self-comfort which develops in a child. This can actually develop sometimes from the weaning period to the normal feed time. So generally, parents are supposed to sort of gradually wean off the child and not do it abruptly. That's one thing. Some parents suddenly decide, okay, 1 year and we stop. And that's not the right thing. So that exactly should not be done. And the weaning should be tapered off so the child gets comfortable with the next phase, which would be on bottle feeding. So that would be one particular reason for it. And then again, as the child grows up, it is very normal a digit sucking habit for the first 3 years of life. If you find your child sucking his finger or thumb, it's okay. Don't panic, it's fine. but it is a different issue when it's beyond 4 years of age, because 4 years of age is when the bone starts developing more, and that would affect the teeth. So if you feel that a child is pursuing a habit after 3 years of age, 3+, not 3 years exactly, it's around 3.5 to almost 4 years, then you should visit a dentist. This is actually because it's normal during those early times, because it's just that it's in between the child does it, and it's not a 24-hour habit. And it would never be a nocturnal habit, because the child would be on some feed and he's fed well, he goes to sleep normally, so there's no issues there. So usually if it's after around by almost 4 years of age, this actually happens because of some form of insecurity in the child, and the child is drawn to comfort, self-comfort, by pursuing this habit. So the right age to visit the dentist, if you find that the child is still pursuing the habit, would be 4 years plus. And then for this particular thing, we have different we normally counsel the child. The first thing is counseling of the child. First is parental counseling, actually. In pediatric dentistry, it's the parents' awareness that counts more than the child first. So first, as the dentist, we actually always focus on the parent, and then we focus on the child and try to get the child away by counseling from the habit. Well, if this doesn't work out, and then the next step is what we call as mechanotherapy, or it's just a form of a little reminder in the patient's mouth. See, like this, I do have an appliance here, which is, now this is an appliance, a little wire here, where these two wires are fixed in the patient's mouth, and there's a little extension here. So this actually comes, this is the front of your baby's teeth, the child's teeth. So when the child touches here to suck his thumb, which normally he derives pleasure while sucking, is obstructed by this little reminder here. So there are different type of appliances like this, and so these are called as habit reminder appliances, which would be given by the dentist. So this is with thumb sucking.
Okay.
And let's move on to the next question. You said about mouth breathing.
Yes, sir, mouth breathing. Yes.
Well, mouth breathing is very important because it cannot necessarily be just a habit. It could be due to some anatomical issues also. So this could be in cases of deviated nasal septum or adenoids and all that. So normally adenoids, is self-correcting, so we can actually wait and the mouth breathing corrects on its own. But if the child presents with, again, in his early, late dentition age, that is around 4 years to 5 years, he's still pursuing a mouth breathing habit. The first thing is we would refer the patient. If the patient comes to the dentist, we do not do anything immediately. We actually refer the patient to the pediatrician to rule out any possible anatomical issues for the child. If they rule out and say, no, there is nothing wrong here, and then we consider this as a habitual mouth breathing. And for this, we have treatment for it, because we cannot it's not like thumb sucking, we cannot counsel the child, because mouth breathing is done unconsciously when the child is sleeping. But he derives pleasure keeping his mouth open and sleeping. But we cannot tell him to close his mouth or keep his lips sealed when he sleeps. So normally we help with certain devices, something like this. And this is what we call, it's like a lip shield, which is actually given to the child in the mouth, which is worn in the child. It's just slipped into the child's mouth in the nights when he sleeps. Normally, initially, we make perforations on this screen, so the child continues to breathe through his mouth, and then slowly we block the seals. So from mouth breathing, he transfers to the nasal breathing. So these are small devices that you can use to help your child to overcome a mouth breathing. Tongue thrusting is sheer habitual procedure where the child has a tendency, sometimes it starts with wobbly teeth, the child keeps playing with the wobbly teeth and then ends up performing it. And because once the front teeth fall off, and if the permanent teeth are just yet to come, the child can develop a habit. So this is again through counseling, or we have lip habit appliances to restrict the tongue. So these are the things that are normally we focus on.
So, Dr. Jacob, how do you think parents can recognize that a particular habit is developing in a child? In the sense, will there be any kind of signs or symptoms that the child shows that the parents should know that there is actually a problem? And and they have to visit a dentist for a checkup for their child.
Yes, definitely. Now, for the digit sucking or the thumb sucking habits, the first thing the child would notice is the teeth coming out, the proclination of the teeth. The front teeth would be slightly like a buck tooth, the front teeth would be coming out. And this would, this is because the tongue is being, the thumb or the finger is being sucked vigorously and it's pushing the front teeth out. So that's why, so usually, so sometimes by 7 years plus, when the permanent teeth, the incisors come out, you would notice it very well. The parent would notice that these two front teeth are a little outside compared to the rest of his teeth, which means the incisors are proclined outside. Yeah, so that is one of the signs that the parents can note. And then, of course, physically also they can see that the child is pursuing the habit always.
Yes, so that means beyond a particular age, if he's continuing it, and they also notice that the teeth are moving forward, yes, that means they should know that they have to visit. Or I think even better would be that, if parents take the trouble of getting the child, say, once in 6 months for a regular checkup.
Yes, periodic visits to the dentist every 6 months is mandatory. For both for the parent and the dentist. And and also that's with the tongue sucking. And the next one is tongue thrusting is more like, it's a socially unacceptable procedure because the parents start feeling embarrassed because the child is always, And sometimes along with the tongue thrusting habit, when the tongue comes out, another thing is along with that, the child develops the lips biting habit or a lip sucking habit. So that would also be a social not acceptable behavior. So in these cases, the parents would definitely notice it, and it's signs to bring them to the dentist. Yes.
So if tongue thrusting is only is a habit that is developed by the child, and it has not got to do anything with actual problems like anatomical problems or medical problems, sir, how do you think this can be treated? Is it just counseling, or will the child require any appliance?
Yes, we would require, because if it continues, there would be, just like what we were talking about, the front upper teeth coming out, there would be a proclination of the lower teeth, and the bite of the child's teeth will be, the way the child bites and chews his food would be affected. So this is the reason why we give, just like I showed you the previous appliances, I do not have it with me now, but we do have appliances to restrict the tongue. It's almost similar to this. Where we'll have something, an extension in the front here, so that would restrict the tongue. So this will be fixed in the patient's mouth actually. Yeah.
So these appliances that the child would wear not just rectifies probably the growth of the surrounding jaw, but also act as a habit-breaking appliance, which means act as a reminder that he has to stop doing whatever he is doing.
Yes.
And what about mouth breathing, sir? How would the parent know that the child is actually under stress actually because of mouth breathing? Because I think mouth breathing affects a lot of other related structures in the face, and also I think the child goes through a lot of stressful phase because of the mouth breathing habit. So when is it that the parents have to take notice and say that, okay, maybe my child is having a problem with mouth breathing?
Well, actually, mouth breathing, the parents would notice it. Is because the first thing they would say is the child is having a very bad breath. So this actually happens because when the child breathes to the mouth, the whole mouth is dry. There's no saliva in the mouth, so the mouth is dry, and that's when the bacteria have a party inside the mouth. So that's when the parents complain that my child's breath is stinking, it's too bad. Even after brushing, when he gets up in the morning, it's really bad and stuff like that. So basically, that's one sign which they can notice. And the other one is when the mouth is dry, the child is prone to a lot of decay. The teeth, because there is no, the helpful bacteria that protect your teeth is not there, this can develop into a lot of cavities. So generally, these are the signs that normally is detected by the parents, when you see a lot of cavities in the front teeth especially, and then inflamed gums. The gums will also be red and swollen because of the dryness of
Yes, in the gums and probably even bleeding from the gums.
Yes. And dryness, well, inflammation would be there. And these are the signs for all this actually.
So that means to say that these are some things that parents have to actually pay attention to,
Yes,
and the moment
yes,
they notice it, take the child to the dentist, understand the underlying what is causing the problem, so that it can be rectified accordingly at the right time. Because
yes,
I think, sir, because the growth of the jaws and the entire face is happening during this phase till the child is say like 12 or 13 years old. So because these habits also come at this age, it's very important to recognize these at the earliest and rectify them so that the facial growth and development happens properly.
yes.
uh, Dr. Jacob, thank you so much, sir, for sharing all your experience with our patients today. And I really hope people who watch this would understand some aspects about oral and dental health, especially in children. And if some of them are not aware that their children are probably going through a stressful phase, do understand and realize that and take their children to their dentists and get them checked. I really hope that I can have you again for another session on another interesting topic on pediatric child care. Uh,
Thank you.
Thank you, sir. Thank you so much for
Thank
joining
you,
in
sir.
with me today. And I really hope to have you back. Thank you so
Thank
much.
you so much. Thank you.
So that was Dr. Arun Jacob, who did talk to you all about some of the bad habits that are in children and how they can be recognized and how they can be rectified. I hope that was useful to you all. Do click on the like button if you like this video, and do visit our website www.thedentaire.com to get more information about your oral and dental health, and do subscribe to our YouTube channel to get the latest updates. So you can contact Dr. Jacob, his details of which is given below in the description box. And until next time, I come back with another topic with another dentist on your dental health. Keep smiling and be happy. Thank you.